Good morning. Welcome, and thank you for joining us for our Northern Light Health Good Health is Good Business Zoom conference. Spring has officially sprung in Maine, and I hope you are enjoying the sunshine as much as I am. Today is a beautiful day. As we transition to warmer weather, many of us will begin to work on our gardens, plan trips to our camp, and look for more opportunities to spend time with our loved ones while enjoying Maine's great outdoors. All of these aspects of Maine's summer and more bring great joy to so many of us, but we must not forget that even with the joy these activities bring, it remains critically important that we foster workplace environments that further support employee well-being and mental health. Today, following our COVID-19 update, our panelists will provide possible options that are available to support employer efforts in creating a culture of wellness. You will also hear from business leaders who have prioritized employee mental health and learn what approach worked best for their employees and why. I'm Karen Hawks, Vice President of Operations at Northern Light Beacon Health, and I'll be your moderator for the next hour. Please join me in welcoming our expert panelists today. Dr. Ed Gilkey, Senior Physician Executive for Northern Light Beacon Health, who will be providing the COVID-19 update this morning. Yamaya St. Clair, an Employee Assistance Program Counselor for Workforce. Chris Costello, Director of Quality, Compliance, and Innovation at Chan's Home Health and Hospice. Angela Felicia, a licensed clinical social worker and Director of Healthy Life Resources at Northern Light Acadia Hospital. And Kevin Peterson, Chief Operating Officer for Data Capable. Before we get started with today's panel discussion, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and or your customers and clients will not contract or spread the coronavirus. So now that we have that out of the way, let's remind you that this hour is intended for you, and we welcome and encourage your questions at any time using the question and answer function. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Dr. Gilkey will get us started by providing the COVID-19 update today. So good morning, Dr. Gilkey.
Good morning, Karen. Good morning, everyone. So I hear the pandemic is over. Dr. Fauci actually told us the pandemic phase is over in the US. As of this past Sunday on the talk show circuit, backtracking and clarification were addressed. Let's look at some terms. An epidemic occurs when a sudden rise in cases occurs above the expected rate. A pandemic occurs when an epidemic occurs in multiple countries. The bottom line is that the US may, and I emphasize may, be out of the epidemic phase as the worldwide pandemic continues. Let's take a look at some data. This is a worldwide view showing new cases on a single day this past week and was over 400,000 cases. Look at the gray bar. You can see very high new cases highlighted in yellow in the US, Brazil, France, Germany, South Korea, and Italy. And the frightening part about that, that's just the top portion of this report. Let's take a look at the USA. Of note, this curve is turning upward to far right. It's about the same size as last year at this time, but the trend was heading downward last year. I should also mention that the cases are underreported this year due to home testing. Overall, this finding deserves a The next slide does a good job of showing the upward trend in cases in Maine and shows a forecast from the Mayo Clinic with upper and lower bounds on the right side of the curve. I'll add Let's go to a different way of viewing cases in the US. This slide shows the current case rate on the left with the color legend shown above the map. Now look at the map on the right. It shows the forecast for 2 weeks from now. Clearly, the cases are increasing again. With cases being underreported, hospitalizations and deaths become more reliable data to consider. On this slide, we see the slight increase in cases on the far right of the gold line. Down at the bottom, we also see an upturn in hospitalizations on the blue line. Finally, we see deaths are flat on the red line, still occurring every day and anticipated to rise over the next few weeks. Overall, not good. Looking around the world to get another read, we see South African cases are surging again, this time due to 2 Omicron subvariants we haven't heard about yet, BA.4 and BA.5. These are currently both in the US at low levels and are taking the backseat to the BA.2 subvariants that we're getting used to. We'll need to pay attention as this evolves. Let's take a look at what else we know. Immunity, whether from infection or vaccinations, wanes over time. The immediate protection against infection is due to neutralizing antibodies, which decrease over about 6 weeks. Then there's the real strength of our immune systems, the B and T cells. They give us long-term memory, and that translates into less severe illness, less hospitalizations, and less deaths. This protection seems to decrease around 6 months. We also know viruses mutate to evade our immune systems and become more infective. A recent article in the Morbidity and Mortality Weekly Review, which is published by the CDC, shows infection-induced antibodies, so not the vaccination, infection-induced antibodies are very widespread, strongly suggesting 60% of the US population has been infected, including 75% of children. Most of this occurred with Omicron since December. So what's going on here? First, the worldwide pandemic continues. Many cases in the US are not counted due to home testing. US cases are increasing. Even more importantly, US hospitalizations are increasing. US deaths are stable, but we know they lag hospitalizations. Second boosters are recommended for 50 years and older, and younger if immunocompromised. Boosters lower infections somewhat and lower severe illness and deaths significantly. Work is currently being done to develop an annual booster, possibly in combination with the seasonal flu. This may be available in fall of 2023. For fall of 2022, another booster is likely to be offered to most of the population and may be a new bivalent type made from 2 of the variants. So I think that booster will be different. So what action should be taken at this time? Get vaccinated, get booster number 1, get booster number 2 when eligible. When indoors with others, discretion is called for. If your county transmission rate, that's the rate for infections, is designated substantial or high, currently all counties in Maine are high. They've increased significantly over the last 2 weeks. So with Maine being high, then immunocompromised people should wear masks or avoid the gathering altogether. Other people at these indoor events should consider masking as well, since they may transmit the virus without having symptoms. And finally, if someone tests positive, and this is the most important thing I'm going to speak about today, if someone tests positive, has mild to moderate symptoms, and is high risk for severe illness, so that's 50 and older or younger if immunocompromised, get treatment as early as possible within the first 5 days. Get treatment as early as possible within the first 5 days. So let me leave you with a final thought. Pay attention. This is not over. Karen, back to you.
Thanks, Dr. Gilkey. And your last point regarding, if you test positive, seek that treatment. And
Absolutely.
there's some confusion about what is actually available, particularly in Maine, for COVID-19 treatment, and how does one seek that? And so could you provide a little bit more information about the options?
Oh, sure. I think the first place to reach out to is everyone's primary care provider. That's a good place to start. You certainly can reach out to any of the health systems, Northern Light, Central Maine, Maine Med. They all have the staff who are knowledgeable and know where the locations to get treatment are. The treatment is actually at a provider level. I'll share with our audience. It's actually sort of like criteria need to be met. We start everyone if they're eligible for it, and there's actually certain reasons not to give people the medication, but for most people, the start would be with a pill called Paxlovid, which is an antiviral. So what it does is it stops the virus in its tracks in a multitude of ways. The other things that we've heard about in the past are monoclonal antibodies, and thanks to Omicron, we have one monoclonal antibody that actually does treat that. So it's good we have that, but we no longer have the 3 that we had previous to that. So as the virus is evolving, so is our treatments. So those are the main 2. There's several other opportunities, but that would be determined by the providers who are prescribing the treatment. So I think the good thing is most people would start off being eligible for a pill and a series of pills, if you will, or they'll be eligible for an infusion, which is once and done. So there's treatment options, and we have to get people to the treatment as early as possible, accessing through the health systems or preferably through your primary care provider.
Thank you, Dr. Gilkey. And I know in the past there was some supply concerns, particularly when we were going through our surge. I assume, but please confirm, there's not a supply concern at the moment in the state of Maine, is there? Or?
That's correct.
Okay.
If you access those portals that I suggested, you will have immediate access.
Good news. Good
Yep,
news
good news.
indeed. Another question I have is regarding the vaccination of children who are under the age of 5. Parents of young children are anxiously awaiting news that this is going to be approved. Is there any updates that you can provide on where that stands right now?
Well, for that one, Karen, I think I'll start with the bottom line. I think we're going to hear some good news in June. So what I mean by that, why haven't we heard it up to this point? And to deal with the basis of that anxiety that our parents are experiencing, I think the way this was studied for the Pfizer vaccine was at 1/10 the dose. Can we give children under 5 2 doses and they'll be adequately protected? The good news is mostly. The bad news is from the age group 2 to 4, it's not quite adequate enough coverage after the second dose. So it's looking like 3 doses of 1/10 the dose that's given to 12 and older will be necessary. So that's in the final stages of being validated now. The data is becoming available in May, and we're anticipating in June a release of that. Moderna, on the other hand, actually has requested of the FDA an emergency use authorization to extend to age 6 months. And that's a 2-dose series to my understanding at this point. And we're anticipating the release of both of those results probably on the same day or near about, so that both will probably be available in June to that age group 6 months to just under 5 years.
Good news.
Mm-hmm.
You're full of good news at the end there.
I know, but let's not lose sight of what I told everyone to pay attention to.
I know. I do appreciate that as well. So thanks so much, Dr. Gilkey. On the screen right now, and this is included in the slide deck that will also be part of the resources available on our website, you'll see a link that will take you to a web page within northernlighthealth.org site where you can schedule your own vaccine, whether it be you're initiating the series or getting the booster. So please know that this is available to you. Also, as soon as the under 5 age group is approved, I'm sure that this will also be available on our website. So continue to check back, and we'll update our website appropriately to make sure you know where you can access the vaccine. So with that said, it is a pleasure. Thank you, Dr. Gilkey.
Thank you, Karen.
It is a pleasure to welcome back to the panel Yamaya St. Clair, and we also have Chris Costello. Yamaya is going to get us started by providing an introduction to employee assistance programs and the Strengthen Me program specifically, which is a valuable resource for Maine employers. And Chris will then share his story and experience. So thank you both for joining us. And at this time, I'm going to hand it over to you, Yamaya.
Well, thank you. It's an honor to be here with all of you again, and I wish I could be as optimistic at the end as Dr. Gilkey was. But you know, we are hearing from a lot of employees who are just really struggling right now. People are just really tired and you know, just now beginning to grieve all the losses they experienced through the pandemic. So, you know, at the same time, the leaders are really wondering how to motivate them to embrace these updated work expectations as the world seems to be opening up more and more, even in the face of this COVID wave Dr. Gilkey described. So this is complex, and acknowledging the complexity of this transition is really the first step. It may be worthwhile to conduct a facilitated conversation where employees can just discuss what they've experienced and voice their concerns about updated workplace expectations. It's really important to validate what you hear and normalize the fatigue, and then offer just as much patience and compassion as possible. And if you need support in facilitating these conversations, Workforce EAP and the state's Strengthen Me program can provide these to qualifying organizations free of charge. The challenge for many leaders is really how to open up these conversations authentically. So we can go to the next slide here. You know, I've heard managers express a lot of concern that they'll really open Pandora's box to a fruitless venting session if they ask open-ended questions and really give employees the floor. We know, however, that research suggests otherwise. Studies recently published in the Journal of Organizational Behavior looked at acknowledging others' emotions in the workplace and found that the trust that comes from verbally recognizing how employees feel, particularly when they're sad, upset, angry, it really helps form a much deeper connection. And you know, that relates to psychological safety, which is something you've probably heard me talk about before if you've participated in this panel. You know, employees working within psychologically safe cultures perceive they can take interpersonal risks, such as speaking up, admitting a mistake, acknowledging confusion, even offering a dissenting opinion without risk of feeling like they'll be punished or rejected. And that's really important, right? And you as a leader can promote this kind of culture by acknowledging how challenging the circumstances are, really owning and vocalizing how you can improve, and thanking people when they do speak up or admit a mistake. And of course, what we're looking for here, what all of this helps to build is trust and ultimately loyalty, and really helping to take care of our workforce. But you don't have to do this alone. If you have resources you can offer, such as an employee assistance program, have them readily accessible. And again, qualifying organizations can access resources through Workforce EAP and the State of Maine Strengthen Me program. Here you'll see the variety of resources we offer. And if your organization does work within the healthcare sector, you are eligible for free services through this program. So if you think you wonder you may or may not be eligible, please give us a call, reach out to us at 1-800-769-9819, and you can learn more about how we can support your teams. One leader I've worked with closely through this program is Chris Costello. Chris, it's so nice to have you here. Chris is the Director of Quality, Compliance, and Innovation for Chan's Home Health and Hospice, and he's graciously agreed to join us today so we can learn a little bit more about his team and how he's supporting his employees. So thank you, Chris, so much for being here.
Thanks, Imai. Happy to be here.
Yeah. So can you just tell us a little bit more about your professional role and the team that you lead?
Yeah, so I work for Chan's is a small home health and hospice agency, but within a larger system in Maine Health. Our team is comprised of nurses, physical therapists, occupational therapists, speech therapists, social workers, home health aides, and administrative staff. I may be biased, but I think they're as good as it gets. And in terms of my role, I'll talk about my quality improvement role primarily here. My primary responsibility there is coordinating the execution of our improvement plan and meeting our improvement targets. And so within that role, I also take it as my responsibility to provide our staff with the resources necessary to be successful.
Great.
And so as we're looking at our improvement plan for the following year, at the end of 2021, we're hearing from our leaders that they're struggling and that their staff are struggling. And nobody is feeling like they're able to do much more than make it through the day, let alone engage in a improvement initiative. And so that's when we started looking into what resources are available and found Strength in Me through our EAP director.
Great. Well, yeah, I've been hearing that from so many entities, right? This tricky balance between how do we support where people are, which is that we're just incredibly fatigued, tired, barely make it through the day, and also get to all the work that we put off, and kind of parked for a few years, but is essential to moving forward. It's a really challenging situation for so many organizations. So how do you keep a pulse on how your team members are doing?
Yeah, so we have I'll focus on our clinical leaders. We have a weekly meeting with our clinical leaders, and we've been doing that since prior to Strength in Me. And we do give them the opportunity at that meeting to talk about pretty much whatever it is they want to talk about that week. But in terms of keeping a pulse on how people are doing, I think that's where Strength in Me has been really beneficial. And so our senior director has allowed us to use the time at that meeting every other week to have our Strength in Me sessions. And it's really put the idea of how are we doing more out in the open. And I've seen people making positive changes because of that. So yeah, I think Strength in Me has been really beneficial again in just opening up that conversation and allowing that to be allowing that topic to be out in the open and structuring the conversation more than we were able to before.
That's so good to hear. Any examples of kind of, you said you've seen some positive changes. What does that look like? I know we've come in and facilitated conversations on things like professional boundaries and really how to help oneself just cope with stress and a whole range of topics. I'd love to hear if there's any particular feedback you've received or anything you're seeing.
Yeah, you mentioned the session around setting boundaries. So, after that session, we saw leaders setting boundaries on not being interrupted while they're working, and again, just setting the boundaries around that. We've had conversations about setting boundaries around checking your email on nights and weekends, and I've seen our leaders make changes around that have stuck so far.
And hopefully make them, during the time that you do need them to work, more able to focus and do so without feeling, a little bit of more fatigue and maybe some resentment, right? If they've been able to really decompress when they need to decompress, so then they can show up when they need to show up.
Absolutely. And that's what this is all about, is giving people the support they need so that they can be their best while they're at work.
Yeah, great.
That's what it's all about.
I guess my last question is just, what tips do you have for leaders who are looking to open up dialogue with their teams?
Yeah, so I've thought about the difference between, so these aren't new concepts, right? We've been talking about these concepts for years, but kind of in bits and pieces, and sort of one-off trainings, and sort of, let's face it, grossly underutilized wellness programs and things like that. And so what's the difference between that and what we're doing now? And I think one thing is that it's all put together in one program. And it's led by experts in leading discussions around these topics. It's done on work time. We've made it a point to do it on work time. And my mantra has been, if you didn't think it was part of your job to take care of yourself before, know that it is part of your job now. And we've shown that by having these sessions during work time and have it be paid time. And so in terms of tips for leaders, I think that my first tip is get started. There's plenty of negatives around the pandemic, and I think we need to take advantage of the positives. And I think this is a positive, and the positive being, I think there's an atmosphere where people are ready to have these conversations, and people want to have these conversations. And also the resources are available to help with it right now. And so that's my second point, is take advantage of the resources that are available, and Strengthen Me being one of them. And these are the resources that can help meet your teams where they're at, and also make the experience feel genuine. And again, going back to making it part of the job, I think that's really important, and that needs buy-in from senior leaders. So engaging senior leaders in prioritizing this. And then I think more logistically, I think it's important to have a point person that's going to collaborate with whatever resource you choose to use, that's going to help carry out the plan, that's going to sort of be the general champion for the cause.
Excellent.
Yeah.
Well, I really appreciate that you've been that person with your organization, and everyone on your team seems like they've really benefited for it. So thank you again, and I'm going to pass it back to Karen.
Thank you both. And I actually have a question that I'd like to pose before we transition, because it is very timely. It's an excellent question asked by one of our audience members, and that is that, it might be relatively easy in some organizations, given the culture, to get buy-in and support to establish an EAP or Strengthen Me program. But for those who are in an organization where it's not part of that culture yet, where it's difficult to get that conversation started, how would you suggest you do that? How do you get buy-in and then the support and trust in the program? And that's for both of you. I don't know who dares go first. Who's the bold one? I'll let you decide. Maya or Chris, go ahead.
I'm happy to take it from my perspective.
Okay,
first.
that'd be helpful. Thank you.
I think it's all about showing the value. What's the value? And I think we can't afford not to do it. I think that, go out and find the research. It's there. People who are happier and more engaged at work make less mistakes, are more productive. So the research is there on that. And I think that we are all in an environment right now with the workforce that we have, that we cannot afford to lose one good employee. So that's sort of how I see it. We can't afford not to do it.
That's beautiful. I'll just add one piece to that. I think that's summarizes it in an excellent way. And cultural change is slow. Acknowledging that, and And coming with ideas for solutions is a great way to move a process forward. So instead of just saying like, we don't have a culture of psychological safety here and we need better support for our employees, doesn't offer people much to work with, right? But saying, hey, here's the research, here's a program in Strengthen Me that we can utilize, here's this, come with ideas for solutions, and people will be much more willing to, I think, hear that and work with you to implement those.
Thank you very much, both of you, for your thoughtful responses. And I know you are very good at being quick on the draw with that unexpected question in the middle of a presentation, but I appreciate the thoughtfulness. So with that said, we're going to transition now, and I'm going to invite Angela Felicia to speak about Healthy Life Resources, a program truly designed with the main employer and employee in mind. And then Kevin Peterson will then share his experience, including the why, when, and how as it relates to supporting the mental health of his employees. So welcome to you both. And Angela, thank you so much for getting us started.
Hi, Karen. Thanks. And I'm glad to be on the webinar again. It's always nice to do these. So I'm also pleased to be talking about Healthy Life Resources today and employers and employees' mental wellness, psychological safety. You'll hear me talk about that as well, as Yamaya did. One of the things that we recognize here at Acadia's Healthy Life Resources is that you really shouldn't, nor can you, separate the head from the body. And we really wanted to design a service that considered that holistic wellness from that perspective of when you take care of your mental, emotional wellness, you're actually taking care of your entire person. Next slide. And you can see kind of right in our vision and mission that we sort of embedded that concept of that holistic self-care when we designed this program and really thought about how we can help employees and employers really meet that holistic needs of their employees. Both Chris and Yamaya talked so eloquently about how important it is and how we can't afford not to pay attention to that mental, emotional, psychological wellness, particularly now as we're continuing, unfortunately, still in that pandemic phase. Next slide. So how do we do that? One of the things that we do is to really focus on resilience. So developing resilience as an individual person, but then also developing resilience as an organization, as a team, and that includes developing culture. So a culture of resilience where employees feel as if it is safe to say, gosh, I'm particularly stressed. I need to take a break. I need to set some boundaries. I need to take care of myself. Use my PTO, for example. So really developing some of those tools and skills and creating that culture where all employees recognize and feel safe being able to do that, which then goes to supporting employees doing their best work, reducing absenteeism, people calling out, reducing presenteeism, where people are showing up, but just going through the motions, not bringing their best self. So we want to do that in a way that also prepares us for future crises. Even when the pandemic is officially over, there will be another crisis, right? So setting that stage of resilience and psychological readiness is critical. Next slide. And I always think about these strategies in the terms of a pyramid. We think real traditionally in mental health, and I've been in mental health 20 plus years or so, and you generally think about mental health, mental wellness as individual one-on-one sessions with a counselor, a psychiatrist, a psychiatric nurse practitioner. And that is certainly crucially important, but that's also a really small part of that pyramid. There's so much around mental wellness, psychological safety, emotional readiness that can happen in departments, in work units, in organizations, even in how we design the physical plant or layout of office spaces or buildings. all of those things combined lead to that idea of systemic change, where you're creating a culture of caring for both the physical and the mental well-being of your employees, which then, as we know and as research tells us, contributes to the workforce remaining healthy and doing a good job, no matter what your business is. Next slide. And we've done that through some pretty specific services. And a partner of ours through Data Capable, and Kevin Peterson, he's going to talk about how that's looked for his organization. But really, these 4 big pronged approaches here. Those leadership support training, so training up leaders so that they're comfortable doing some of the psychological readiness in the workplace, not intending to turn anyone into counselors, but providing them with tools that they can utilize with their team. That sort of builds capacity in the organization. And then consultations and impact. Myself, another team member of mine, we met with Kevin and his team member on Friday to do just that, kind of consult with, where's your team now? What do you need in the future? And then when and if critical incidents happen, doing debriefings, critical incident stress management with teams. And then finally, data analytics. So we've really started using health plan claims data and population health perspective to really think about what will be those specific strategies for individual organizations. Next slide. And I'm going to invite Kevin to turn his camera back on. Let's see if I don't see him. There he is. Hi, Kevin. Good to see you.
Likewise.
Great. So Kevin, I'm just going to start by asking you to sort of describe your business and why you are looking for a mental wellness partner.
Definitely. So we are a technology company at our core, and our primary mission is to deliver situational awareness when it matters most, with a focus on people and assets and communities. So that's a lot of words. What does that actually mean? What do we actually do? So what we do with our technology platform is detect when events are happening that may impact people or assets, and then pass that information on to our clients and their end customers and communities. So that might mean something like a civil unrest event that has turned violent, or it might mean something like an active shooter in a community, or it might mean something like a large storm event is coming. So what is the community doing to prepare for that? And then what are the impacts as the event comes through? And then finally, how is the community recovering from those events? And for us, with the criticality of the information that we provide and the data that we provide to our customers, we don't rely purely on our technology. So that means we have a human element intertwined with our technology, so that we can ensure that the information and data that we're providing to our end customers is accurate and timely and real. And with that, as I've just talked about, there's a lot of potential exposure to events that are impactful to our employees, both from an acute perspective and also from a chronic perspective. So we have people who are living and experiencing these events every day. And that was really what created the emphasis for us in our organization, to know that we needed to provide some extra support for our employees. We needed to build some resilience in our employees, so that when they are exposed to these acute events, or seeing these type of events, or these happening in front of them every day, that they are able to handle that, but also knowing that we needed to build a culture that allowed people to say, I am struggling, I need help, I need time off, whatever it might be. So that's really was the genesis of us kind of reaching out and trying to find a partner that could help us build some of this in our organization.
Yeah, that makes a lot of sense. And it sounds like from the work that you all do, your work inherently is around finding crises and
Exactly.
responding to those, right? So your workforce is sort of already primed to be looking at crisis, and then we layer on top the last 2 years of a pandemic, which certainly has changed your workforce as it's done for everybody. So can you talk about the ways in which the needs of your workforce has shifted over the last 2 years and how that's impacted things for you all?
Yeah, absolutely. So as a company, we're already 100% virtualized, 100% remote. So that initial challenge that a lot of folks had to deal with, we were well positioned to handle, but there are a lot of things that happened around the edges of that changed employees' ability to deal with and handle all of this stress and change that is impacting them. And immediately my concern was, well, we're taking away a lot of these people's outlets. So whether it's being able to get to the gym or going out and being part of your social circle, any of those types of things, like, okay, I get off work, now here's how I decompress and deal with things, those immediately went away for a lot of these people, and that created challenges in and of itself. And then on top of that, the need for our services increased over this 2-year period with both the pandemic and workforces going virtual. So where we were focused on tighter areas historically, now we're looking at a much broader environment. And then we had things like the civil unrest and the issues that have happened around that across the country with some of the events that happened. And then, finally, the company has essentially doubled in size over that same period of time as well. So lots of stresses, lots of impact to our team that happened as a result of the pandemic, but also in conjunction with the pandemic.
Yeah, absolutely. And you of course brought up the civil unrest in addition to the pandemic, right? So there's kind of a global disruption that we've all been through as well, that you were recognizing and wanting to sort of be in front of and be proactive of for your employees. Can you also then talk a little bit about how you see sort of mental wellness, psychological safety, preparedness being infused into your culture, or what you sort of hope will get infused into your work culture?
Yeah, absolutely. And I think, and as we sort of started down this path on this journey, we realized there's no silver bullet. There's no quick answers. There's no like, oh, we're going to bring in a professional and our organization is going to be resilient, ready, and able to handle all of these things that are happening. But really, for us, we're a tech company at our core. So we're everything that you think of a tech company. We're fast moving, we're hard charging, we work long hours, we work hard, we stretch ourselves because we're always struggling with this expansion as a company, but keeping that aligned with cash flow and our ability to add resources. So we are all of those things. But as a counterpoint to all of those things, we're really trying to create a culture of transparency, a culture of trust, a culture of safety where our employees are comfortable to have the conversations in the workplace, and really building this into the fabric of the company. So as we continue to grow, as we continue to expand, it's easy to lose some of these things that traditionally aren't thought of as core business competencies. So we're trying to build this into starting at the top with our top leaders in the company, building the knowledge, the tools, the information to continue to assess our organization as we grow, but also ensuring that as the company grows, this is who we are as a company, not just something that happens on the side of everybody's desk, but much like most of us have probably experienced in the workplace, the culture of physical safety, where you start out a meeting talking about your exit routes and where your fire extinguishers are, and a safety message. We're trying to build that into our company and our culture so that it isn't a separate meeting. It is built into every meeting that we have. We're starting out the meeting talking about these issues, or talking about the events that may have impacted our employees over the last period of time, but also just being very real as leaders in our organization and understanding it's okay that we're not having a great day. It's okay that we're struggling, and modeling that behavior. So, I will be the first one to show up to a meeting, and if I'm having a tough day, I'll let everybody know I'm having a tough day and I'm not at my best, and I might need some additional support. So making sure that there's space for that, and there's comfort for that in our organization, so that, again, as we continue to grow, it is really who we are as a company, and not just flavor of the month. Because I think that's the other really important thing is, if you're going to start down this journey, you have to be committed to it, because it's very easy to lose credibility with a subject like this in your organization. And the first thing I did was make sure that my senior leadership team was well committed to this and knew that this was something that we were going to continue. And it's not, we're going to take a couple of trainings and we're going to build some tools and we're going to continue on as an organization.
Yeah, not just checking the box.
Exactly.
Yeah, and I've definitely seen that in your team, because we've had many sessions where your senior team is present, and we're doing just what you described, right? Like giving people tools and then practicing the tools, but how to do that check-in, how to do it in a way that's comfortable, and continue to get the work done as well, so that it doesn't mean that, oh, work has to stop just because Kevin said he's having a hard day or Angela's having a hard day. That those two things can happen all at the same time.
Exactly.
Can you share a little bit about the ways in which this partnership that we've created has been helpful, or can you think of anything specific that you've been able to implement?
Yeah, absolutely. So, when we started thinking about this topic inside of our organization, we knew that we needed to find a partner that had flexibility, needed to find a partner that was going to be able to work with our team. I mean, the reality is, like, we're a bunch of developers, we're a bunch of engineers. We're not exactly known for, having these sort of real conversations, these conversations that drive emotion, and being caring people, I would say, in general. So for us, it was finding a partner that could kind of understand that as they came into the organization. And then for us, it was about building that knowledge and core competencies out of the gate in our senior leadership team. Again, that approach of, we need to start at the top here. We need to build some knowledge, build some skills in the senior leadership team, so that they can then understand why they're having the conversations, why we're building this into the organization, and really getting comfortable with it themselves. I can tell you, the first two sessions we had, it was a little bit of a struggle to get people to engage in the sessions. Like, people understood what we were trying to do, I think, at some level, but it was still like, oh, this doesn't feel comfortable for us. So, I think right out of the gate, Healthy Life Resources created that platform for us to start to have those conversations, understood that this wasn't really in our wheelhouse to start out. And then on top of that, once we kind of started to build some of that knowledge, we then started to layer in the tools. So how do we now take this and drive the knowledge and information that we've gathered as a leadership team? How do we start to drive that down through our organization and put all of this stuff into practice? So, like, I think Healthy Life Resources helped us create that platform, helped us get comfortable with it, and then B, gave us those sort of tools and tips to then drive that down into the organization and start to get comfortable with having these conversations and creating space for this within the organization as on whole.
Awesome. I'm thinking back to some of our initial meetings, and people are now, like, we end up going overtime, right? Like, people are super talkative. Initially, it was like, oh, I don't know, this feels awkward or uncomfortable. So yeah, I've seen a lot of growth for sure, which has been really exciting for me too, personally.
Yeah, absolutely.
I'd like to turn things back over to Karen.
Thank you.
Next
Thank you
part.
both. Yeah, I really enjoyed hearing your story, Kevin. I definitely appreciate the fact that you kept it real and let us know it didn't necessarily start off with everybody feeling comfortable. You know, it took some getting used to. I think that's always something nice to acknowledge and appreciate. And so thank you so much. At this time, we do have a few moments for some questions. So I'd like all of our panelists to turn on their cameras as we transition to that portion of our conference. And again, I'd like to invite the audience to submit questions using the question and answer function. So my first question is going to be for you, Yamaya. You mentioned that Strengthen Me program is available for qualified employers, and I believe you defined qualified employers as healthcare organizations. So for employers who are not healthcare organizations, are these services still available to them, and how would they go about accessing them?
Great. So two parts. First of all, we're fortunate that the state of Maine has taken a really generous approach to what defines a healthcare worker. So if you feel like you may or may not qualify, you're not sure, give us a call and we can help walk you through that. Second, most or many of the services that we provide through the Strengthen Me program for free to healthcare workers, we also provide in a fee-for-service model through our EAP. So if you're looking for a facilitated conversation, if you're looking for individual short-term counseling.
Did she break up? I think she did. Okay. Well, we will let her reconnect and finish that thought when she's able to. This is the benefit of being on virtual, right? We just have to go with the flow, and we've gotten used to it after 2 years. So with that said, Angela, I'd like to throw the next question to you. We have many small employers that chime in and watch this, log in and watch this conference, many who reach out to us for regards to the resources that we offer. For those small employers or employers who question whether they would have the resources to do this type of service for their employees, how do you respond to that?
Sure, that's a good question because that often comes up. And we've worked really hard to create almost like a menu of service offerings for folks. So one of the first things that, just as the example, because Kevin is with us today, one of the very first things we did, we just had a lot of conversations about your organization. What is the current culture? What are you hoping to achieve? And then really design a plan that supports the organization's goals and is affordable as well. So we don't really have an out of the box, here's what we offer you, but we'll design that plan so that you can make sure that it's affordable to everybody.
That's good to hear. So I wanted to make sure we found time to make sure you highlighted that. And
Yeah.
I'm going to ask Kevin and Chris this question, and I'll have Chris go first. You both spoke a lot about how these programs support the leaders. And I'd really love to hear how this feels and looks from the frontline staff's perspective. How are they feeling the benefits of these programs?
Yeah, for us, we intentionally started with our leaders because, again, our leaders were coming to us saying that their staff are coming to them with issues that they're not sure how to best address. And so one of our initial goals was to give our leaders the resources that they need to help their employees. And so I think it has a effect in that regard, and that we're training our leaders how to better help their staff and how to direct them to the right resources. And then in addition to that, we're also trying to expand our use of the Strengthen Me program to our staff in a strategic way as well. And so I think it's a work in progress, but yeah.
Yeah, I would echo Chris that it's certainly a work in progress for us, but our approach has not been to make a big deal about this in the organization. So it hasn't been, hey, look at all the great stuff we're doing to support you as employees and all the investments that we're making as a company and you as employees, but more just trying to layer this in so that when we're having these conversations, whether it's a Slack conversation, you know, over a typed message, or whether it's a conversation with our employees, it's just part of the conversation. So it hasn't been that we're being very overt about it, but more subtle about our approach into it. And one of the tools that we put in place to sort of measure our success here is we do a quarterly pulse check with our employees. So it's an anonymous pulse check, and we ask how they feel about how they're being supported, or we ask questions about, you know, how the workload's impacting them, so that we're kind of creating a baseline of data here to understand how these programs are impacting our organization. And we're about half a year into that effort, and I think that will start to bear fruit for us on how we continue to layer this and build this into the organization. So like I said, it's been a more subtle approach with our employees, and that's intentional, because there's lots of fanfare around a lot of these programs sometimes, and I think that comes across as like trying to convince our employees that we're doing things right. And what we're trying to do is demonstrate that our employees to our employees that we're building this into who we are.
I love that. And Kevin, there is a question here. How large is your organization? How many employees do you have?
So we're 25 employees currently, and we expand to about 40 with contract resources.
Very relatable for Maine businesses. Yeah, that's great
Absolutely.
to hear. Yeah. Fantastic. I appreciate you both coming today. I am going to ask Dr. Gilkey the last question, but I do want to just say one of the things that I've learned in terms of looking at how we sustain a program like this beyond the pandemic, right? I think the pandemic kind of highlighted for many employers that we need to get a handle on our employees' mental health. But the idea, Kevin, of integrating psychological safety into an employer's safety plan. And Chris, you mentioned making this a part of our job responsibility, right? So possibly even embedding in a job description, that idea came to mind. So I think you both really emphasize the fact that in order to sustain this is going to have to be something that is part of the culture. So I really appreciate the work that you've done for your employees. And Dr. Gilkey, the last question I do want to ask of you, you mentioned that Dr. Fauci, I should know that name, we've heard it for so long, now states that the pandemic phase is over. Does that mean that we've transitioned to an endemic phase? And if so, what does that mean? Some clarity on kind of what the future holds.
You know, I think we need to probably move away from these terms. I'll call them labels. You know, this is still a very dynamic worldwide pandemic going on. I think the good thing that we're seeing is you heard me mention about 60% of U.S. population has been infected. You may recall, probably 2 months, maybe 3 months ago, I suggested that over the coming 6 months, everyone will be exposed. Now, not everyone will be infected, but a lot will be. So we're already 60% into that. The children, which includes, a part of our population that's not eligible for vaccinations, they're 75%. And this is all based on statistical measurements, what they're estimating here. So we are kind of approaching what you might term the endemic portion of this. And to try to see forward, usually we have the benefit of Dr. Jarvis and his crystal ball. We'll kind of tap into that kind of thinking. The likelihood will be we're going to see these subvariants, maybe other variants of concern ongoing for the indefinite future. What we probably will see in about a year or so is we're going into a glide path where the coronavirus just becomes a part of everything that we're seeing, and we'll be able to manage between some infections still going on, Some people will still die going into the future. Vaccinations and boosters will be protective, particularly against that severe illness. So, and that will be where we kind of just incorporate this coronavirus as another thing that we have to deal with. And that's probably, 12 to 18 months into our future, I would guess. And my fingers are crossed as I state all this.
Mine are too. So I appreciate that. And in 12 or 18 months, we'll check in and see how we're doing. So thank you all for joining us, and a special thank you to our panelists. Just a reminder, you can find recordings of all of our Zoom conferences, including today's, on our Northern Light Health website. I hope this hour has been a help to support you, your employees, and our communities. And just a reminder, we will be emailing you a survey right after our conference, and please be sure to provide us with your feedback. It helps us with future planning. Our next session will be on June 9th, when we will provide the latest on COVID-19 and have a focused discussion on the topic of growing, retaining, and engaging our workforce. As Chris said today, we cannot afford to lose one good employee. So this session will provide innovative ideas directly from Maine business leaders on recruiting, retaining, and engaging employees. We will send you the link for this session, and we encourage you to share the invitation with your friends, colleagues, and others who might benefit. We certainly hope you will be able to join us. By working together, we will keep Maine safe. So I look forward to seeing you on June 9th. Thank you and have a wonderful afternoon.